At the beginning of every year, I get the opportunity to speak to a class of nursing students all about resumes, portfolios, and interviewing. And this is a subject I absolutely love, and I love teaching about it. I also have done a lot of research in this area. So today, I want to discuss with you all the top nursing interview questions and how I would go about answering them. Every nursing interview can look vastly different depending where you are applying to. Are you applying to a hospital, home health, outpatient center, etc.? Finding that one right position for you can be very challenging, but nailing that interview will help get you that job. But first, how are you going to even find that position? And this is where I'm happy to introduce today's video sponsor, Incredible Health. With the help of Incredible Health, you can find yourself a permanent nursing role where the healthcare employer applies to you instead of the other way around approach. Creating your portfolio only takes 2 minutes. You tell them all about the locations that you want, shift preferences, your specialty, and their algorithm does the rest. So no more searching job finders for hours and hours like I did when I was a new grad. Here on Incredible Health, employers are competing for you. But not only that, Incredible Health helps you through every step of the process. They don't leave you hanging. They help with mock interviews, career coaching, and even resume reviews. But to get through that mock interview, you have to know the interview questions first. So here we go. Let me lay them out for you. Let's go through the top nursing interview questions and how I would answer them. Regardless of where you are applying or to whom you are applying, remember that your sole purpose in this interview is to communicate why you are the most valuable candidate for this position. This is your sole priority when you are answering these questions. So remember that as I go through these questions and I show you and tell you how to answer them. So first, let's talk about the most frequently asked question, and that is, tell me about yourself. So what is the employer looking for in this question? What do they want to hear from you? I can tell you they are not looking for your life story. Remember that this is an interview. This is a professional setting, so you want to keep all of your answers professional. So keep your response professional, also remembering to get the point across why you are the most valuable candidate for this position. So here's how I would go about answering this question with keeping the focus on my professional life, not my personal life. Well, as you can see from my resume, I have been working as a nurse for the last 7 years in a variety of settings. That is how you open. You want to direct the focus back to your resume, and you want to give a brief description of your resume from oldest information to newest in less than 1 minute. So of course, this answer is going to look different for everybody, but to end this answer, this is how you go about it. And that is what has brought me here today and why I'm excited about this opportunity. The focus is on this opportunity, this job, not your jobs of the past. So steer the conversation back onto this opportunity. And of course, why you are the most qualified for this opportunity. So moving on from the top interview question, most employers will now move into behavioral or situational questions. There is a very specific way on how to answer these questions, and that's what I will be reviewing with you. And you will want to stick with this way on how to answer these questions, or you'll probably get tongue-tied while trying to answer your question or not even know how to answer this question. One of the most popular situational or behavioral questions that you may hear goes something like this. Describe a situation you had to work closely with a difficult coworker. How did you handle the situation? Were you able to build a relationship with this person? When preparing your answer for questions like this, I want you to think 2 things. What are the values that a nurse holds or should hold, and how do you hold those values yourself? Now let's use a specific technique on how to answer these questions. You may have heard of it called the STAR technique, but I actually go 1 step further and use the START technique, S-T-A-R-T. This stands for situation, task, action, result, and tie in. So when answering this question, Start with S. What was the situation? When you are explaining the situation, never talk badly about anybody, never gossip, and never make anybody look bad. Next, move down to T, the task. What was the task that was trying to be accomplished? What went wrong or what went right? Next, we're moving on to A, which is action. Describe what action you took and the rationale behind that action. Why did you determine that was the correct decision to make? Explain that in this step. Now we are moving on to the R, and that is the result. Highlight what you accomplished and the overall result. Remember, this is to show the employer why you are valuable. So make sure you pick a situation that shows just that. And that brings us to our last letter, which is T, and tying it all together. Again, what are they looking for? They are looking to see why you are valuable to them. That is tying this whole situation back together. These types of questions can be very challenging to answer. I highly recommend preparing yourself for these questions before going into your interview. Write them down, think of your situation, and go through the START technique even before going into your interview so you don't get tongue-tied while you are actually answering your questions. 5 other really common questions just like this are: give an example of a time you had to interact with a hostile patient. How did you handle the situation and what was the outcome? Tell me about a time you did not know the answer to a tough situation. What did you do? Talk about a time when you felt overwhelmed with your work or patient load. What did you do? Tell me about a time you were under a lot of pressure. What was going on and how did you handle it? And tell me about a time you stepped into a leadership role. To find more questions just like this and to help you prepare and practice, there is a link in the description of my video to the top 31 nursing interview questions from nurse.org. It will also guide you through how to answer these questions. It does not give you the answers, as every answer will be very different for every person, but it will guide you as well how to answer these questions. Again, I encourage you to write down your answers, practice them in front of the mirror, and that is so incredibly helpful when preparing for an interview. So my takeaways for you all today are: never talk badly about anybody in an interview. Use adjectives to describe nurses that also describe you. Explain why you are the most valuable candidate for the position. And do not forget to use the START technique when answering behavioral and situational questions. Thank you again for today's video sponsor, Incredible Health. If you want more information on them, you can also find a link to their website in the description of this video. But other than that, that is it for today. If you have any questions, please comment down below. I would love to hear from you, and I would love to help you land that nursing position that you want. Have a great day, everyone, and I'll see you in next week's video. See ya.